Hi, it's Paul here, the Chief Executive. Just giving you an update on what we've talked about at our November board meeting. It was a very busy board day as usual, and we started off the board, as we always do, with a story about patients. And this time we had a very interesting couple of stories from Kate Brookman, one of our respiratory nurses, who's also now a nurse consultant for integrated care, working as part of our Symphony programme. How we join up care between hospital, community services and particularly primary care services. And Kate gave a really good couple of examples of patients where she had been working with the local GP for the patients, with community nurses, with practice nurses and health coaches to try and make sure patients were looked after in their own home rather than being brought regularly back into hospital. So these were patients who'd had a regular experience of coming back and forth into hospital, regular frequent appointments with their GPs and still not getting the optimal outcomes. Through Kate's intervention with a variety of other professionals, we were able to manage these patients in a much more effective way in their own home, improve their health and well-being, improve the carer support for them, and most importantly, reduce the need for them to be regularly going to the GP or being brought into a hospital. And that's very much what our Symphony programme is all about, trying to make sure that we enable and support people to live independently in the communities with their families and friends, and only need to come into hospital or see their GP when it's absolutely necessary. So it was a really good couple of patient stories to start our board meeting off this month. We also spent a bit of time at the board talking about the organisation's plans for winter. As you know, winter is always a busy time for us here at Yeovil Hospital, and we have a number of plans in place that are being put into train now to make sure we're as prepared as we can be. You'll know that we have already last year contracted with a local nursing home, Cookson Court, to provide step-down rehabilitation beds for patients who no longer need to be accommodated here at YDH. And we're looking at developing and expanding that facility over the coming months, and also thinking about the opportunity to develop a home care service linked to that, to make sure that we're able to support people who need to go home with domiciliary care to get back home as quickly as possible and be re-enabled in their own homes, rather than necessarily having to spend their time in a bed either here at the hospital or indeed in a nursing home. So we spent a lot of time talking about that, our approach to that, and how we were going to make the finances work for that particular model as well. We spent time talking about performance at the board, both in terms of clinical outcomes performance and operational performance. Very positive to see some of the indicators on the clinical quality improving. Our mortality rates, for example, still remain good despite the increasing activity and acuity of patients that we see. But we also spent time looking at our operational performance and where we have some particular challenges. Our RTT, our referral to treatment time, where we have to treat people within 18 weeks of referral to hospital, is nearly at the target level we need it to be. But we have a couple of challenges in some specialties, particularly dermatology and oral max fac surgery, which the elective care business unit are working on very actively at the moment. But the really good news was that we were able to report to the board that we'd achieved the 4-hour standard for patients coming through the emergency department in October and November, which was 2 successive months of that, achieving that performance, which is a really fantastic achievement for not just the staff in ED, but the patient flow team, the discharge team, and staff across the whole hospital who've made it really a focus over the past few months to look at how we improve our patient flow to get people out of the emergency department as quickly as possible and either discharged or back into a bed within the main block. And I should say as well, that's a really good performance, not just for us here at Yeovil, but if you look at our performance nationally on those metrics, we're doing very well, sometimes in the top 10 in the country of hospitals performing in that area, so it's a really good story to tell the board. We also had an interesting presentation at the board from a company called Crab, which is a new system that we just purchased as an organisation, which is looking at how we can measure clinical outcomes of patients. It's really important, obviously, as a hospital that we can show that the work we're doing and the interventions we're making for patients are delivering good clinical outcomes. And that could be in terms of outcomes coming in as a non-elective emergency patient, or indeed the outcomes for patients coming in for surgery, such as hip surgery or cataract surgery. And as I said, we've now purchased this new system which enables clinical teams to look at the outcomes of their own department and right down to the individual clinician who's been involved in that procedure. So we're very keen to make sure that that is shared as widely as possible across the organisation to enable teams to look at how they're doing and how they're delivering outcomes in their area and in their specialties, and we'll be rolling that out over the coming months. So it's a really positive step forward. Tim Scull, our medical director, and Tim Porter our Associate Medical Director, are leading that work, and we'll be sharing that more widely across the organisation as we go forward. The final thing we talked about at the board was a lot of discussion around our finances for this year and also our financial position moving into next year. As you know, we have a very challenging financial position this year with a target cost improvement plan of £8 million. I'm pleased to say that we're on track at the moment with our CIP and forecast to deliver our budget at the end of the financial year. But obviously it is a big challenge, and we need to keep the pressure on and keep focused on delivering our improvements financially over the coming months. The board also spent a large amount of time talking about our budget for next year, and we have to agree our budget by the 23rd of December with our regulator, NHS Improvement. And the reality is that we're going to face a similarly challenging year next year with a similar level of cost improvement plans, but we've taken a view as the board that we believe it is achievable. It will require us to think quite radically about how we work as an organisation, how we deliver care, how we use technology to improve the way we deliver care more efficiently, how we look at different clinical pathways with our GP colleagues to try and care for people outside of hospital. But I really strongly believe that if we think about these things in a very different and radical way, we can deliver the efficiencies that are required of us. But we had a great deal of debate about that, and obviously the board are always clear and make sure that any discussion around finance is always taking into account the balance of the impact or any potential impact on quality and patient care, and that was a large part of the discussion we had when we were talking about the budget position for next year. So you'll see more, no doubt, about the financial challenge for next year over the coming months, and also the continued focus through our work this year to deliver our cost improvement plan for 16-17. So as I said, it was a really busy board, a lot of topics being discussed. As you'd expect, there's a lot going on in the organisation that the board are overseeing. But if there's any questions, as always, about what you've heard today, please just drop me a note. Otherwise, I look forward to giving you an update from the December board next month. Thanks very much.